Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
All right. Happy Q&A day today. So everyone is back from vacation. Everyone is here. We also love celebrating wins in the program. So this week we want to celebrate. He started the program at 44 out of 132, and in 5 months was down to 9 out of 132. So congratulations to. And started the program at 160 out of 100, started the program at 60 out of 132 and is down to 11 in only 4 months. So congratulations to both of those members.
Nice. Good work.
And without further ado, we can start with.
Hi guys, calling in from England. Thank you very much for the new version. It's great. I had just started on the old version, got through mostly through Melinda's, and then I've restarted, and it's just been a great way to just reinforce the very important topic.
Good.
But my question is, so I'm about 8 years out from my concussion. But I only started to understand that I had a concussion about 2.5 years ago, and sort of was going all around different therapies as we do, and found and joined you guys about 2 months ago. I had been making some good recovery progress before I joined, so I've come into the fix to mop up any lingering symptoms that I've got. Cognitively, I'm doing a load better than I was doing, and I feel like I've got room in my head now for everything again. But I'm still struggling with going out and about, with noise sensitivity, irritability. For example, last night, out to a restaurant, and was doing okay. It was nice and quiet. Then it got really busy. And I've resorted to putting in my loop earplugs just because I was going to have to leave the restaurant otherwise. And I guess I'm leading up to my big question, which is I've got the opportunity to go on a family trip, transatlantic, in about 7 weeks' time, and it'll be with family, staying with family for 2 weeks. And I guess what I'm trying to ask is, how can I spend the next 7 weeks getting myself bolstered enough to be able to do this trip? Because my family are a bit concerned about me making the trip with them. I've not really travelled for about 3 or 4 years, so yeah, that's my question.
What will you be doing on this trip? Is it going to be kind of hanging out, or are you going to be going on hikes? And where are you going? What do you think it's going to look like?
It's going to be a very chilled out, just staying with, visiting my sister and her family. And yeah, just hanging out, probably hiking, but nothing too strenuous. So in terms of physical activity, it'll be I can manage that. I guess it's the being around people, noise. Um, if we go out to eat, my noisy nephews, that kind of stuff. And also the journey, like, it's quite a long journey to make.
Yeah. Yeah. I mean, in terms of like, we'll start with like air travel. So the evidence shows that air travel doesn't do anything to impact recovery. However, just changing time zones is going to be the biggest issue. And that messes up a lot of people, right? Like, if I go to the UK, which I do a couple times a year probably, I'm all screwed up on the way there. I'm all screwed up on the way back. You're just dragging for a few days afterwards. Um, but when you have a concussion, that just obviously results in increased symptoms, increased brain fog, increased fatigue, obviously. And you have basically jet lag, but it's a little bit worse because you're already having symptoms to begin with. So I would just be aware of that. I don't think it's anything to deter you from doing it. Just it's something that just you would have the expectation that, yeah, things are going to be a little bit rough just with in terms of changing times. So that's the first part. Um, the second part is you're going to be staying at your sister's house,
Probably not, no. It's probably some separate accommodation.
like an Airbnb or
Yeah,
hotel.
something like that, yeah. Or in their camper outside of the house.
Right.
Yeah.
Now, the good thing here is that if as long as you have your own space, that, if things do get overwhelming, you always have that out. That's something we kind of tell people just to, as long as you have like an out where you can go and, close your eyes for a few minutes or, just retreat from the noise for a bit to let yourself reset. Um, all of that stuff is good. Just to allow you to kind of get through some of the more difficult situations. Um, in terms of, preparation, I don't think there's any really stuff you have to do. How are you with exercise? Just thinking from an autonomic perspective, how are you with physical exertion?
Yeah. That's one of my problems, which I'm needing to resolve. Yeah. I have the
Yeah.
intolerance. Yeah. Yeah.
Yeah, so there's a few things then I would say. Like you said you have 7 weeks.
Yes.
So in that 7 weeks, I would just continue working on some of the strategies in the program. I think some of the best ones are actually going to be from Melinda's section because it's going to allow you to kind of learn to sit with some of that discomfort, you know. And I would continue to challenge yourself. I would continue to go out for dinner and try to sit with that, uncomfortable feeling a little bit, try to practice some of those techniques like, just breathing while you're there and trying to kind of try to keep the nervous system calm, even in the face of, kind of chaotic events around you. Um, that would really be my only suggestion in terms of how to prepare for it. I wouldn't be too concerned about you going as long as you have a space that you can retreat to in case things do get overwhelming, and then you always have that out that you can always, use. I don't know, Melinda, Paul, do you guys have anything to add to that?
Yeah. I mean, I think Melinda probably will have more, but I just really quickly, uh, what I advise my patients whenever they're doing something that's going to be outside of their normal routine is any sort of physical exercise you can do is training for your nervous system and for your cardiovascular system when you are going to be a little bit outside of your comfort zone. So, I think that you said you had 5 weeks, right, Teresa?
7 weeks.
7 weeks. Okay. So even
Yeah.
longer. So you have almost 2 months. Is that I would really try to focus in on the foundations of the concussion fix. How far did you make it through the course, by the way?
Um, I have just started your section, Dr.
Okay.
Hrkal.
So you're kind of
Yeah.
halfway
Sweet.
through.
Mm.
So I think you have long enough if you really kind of dedicate this. Like I think in short, if you were looking for like a one sentence answer on how to
Mm.
prepare yourself the most would be try to implement the course as much as possible. All the different
Yeah.
aspects. So you've already gone through Melinda's. with mine, it's focused in on what can you do yourself. And a lot of what we do in the course is helping you do things that you're able to do at home. So changing your diet, doing mindfulness exercises, breathing, vagus nerve. And then once you get to CAMS, now you're really going to start building cognitive capacity through blood flow and ultimately neuroplasticity. So my belief is you want to train in as many different ways as possible, because you can't train for a flight. You can't train necessarily for some of those bigger pieces, but you can definitely continue to expose yourself to restaurants in kind of like settings that you have the ability to retreat if you want to. I don't think resting as much as possible is a good idea. I think I would challenge myself again up to that capacity. And so start with focusing on the course, get through as much as you can, because I think the exercise piece, once you implement the first two, it's just exponential benefits when you implement that, in my opinion.
Yep, great, thank you.
Yeah, I would echo what both Paul and Cam are saying here. And, I think because you have so much time, there's this opportunity to prep a little bit. So I think it's great that you were able to share it so early on before you are thinking of traveling. And I agree with Dr. Paul around exposures. So it might be really, really gradually, going into environments that are stimulating, and then leaving after 5 minutes, or the second you notice your symptoms rise, step out, see if you can use some of the strategies that are in my section, the grounding, the mindfulness, whatever really resonated for you. Then see if you could go back in for another 2 minutes and then leave. And then try it again the next day, right? So it's sort of this really micro exposures to sort of help you get used to louder environments, different noises, different physical environments, and seeing if that might help a little bit. And the other thing that I was thinking of, Dr. Cam and Dr. Paul, you can let me know your thoughts, is, what about walking? Like, just if exercise intolerance is still a thing, like, it could be a great thing for the autonomic nervous system just to start walking, like start with 5 minutes, then 10 minutes. You've got 8 of the 7 weeks. So that might just really create a more stable baseline to support travel and your resilience following travel. We often will say, just start with walking, because that's going to really bump things up for you as far as your autonomic nervous system while you're building some of these coping skills for, how you're feeling in busier environments, and sticking with that exposure therapy, using some of the grounding skills that I explore in the recovery mindset.
Yeah, walking, I'm doing quite well with my walking. It's probably something I can manage, up to an hour if I'm not having too busy a day. So, but if I try and get my heart rate going any higher, that's when I struggle.
With walking, how often are you walking right now?
Every day.
Okay, and then but how long are you going for?
Oh, sorry. It's anything between half an hour and an hour.
Okay, and
Is
you're
that
fine with that.
I'm okay, yeah, if I'm not too busy during the day. So cognitively, I'm building up my computer use. I'm a writer, so I'm, spending quite a bit of time, a couple of hours on the computer as well, 2 or 3 hours a day. Um, so it's kind of just the reactory thing of, being out with people and in the environment with social environments that's a struggle.
Right.
Um,
What heart rate starts to increase your symptoms? Do you know?
No, I've got the heart rate monitor, but I've not been using it as yet until I get to your section.
Okay.
Yeah,
Okay, that's fine.
yeah,
I mean, I think that the fact that you're doing that much in terms of walking, I think that's great. I would just continue to do that every day, continue working on the computer and continue, going out and about in public. Try to wean yourself off of the earplugs over time, right? So you mentioned you throw in the loops, but
yeah,
try to just breathe through that and try to sit with that discomfort, because your tolerance will increase. But if your reaction is always when things get uncomfortable is to throw these in, you'll never kind of surpass that, that tolerance level. It doesn't grow. So I would say just try to work through that and kind of maybe wean back on that. You can still have them, and I would still carry them with you. And then when you're on this side of the ocean, you can still have them if you need.
Yeah, I think that point of the exposure therapy is to really help wean off those different supports. So it could be this sense of if you experiment with going into a busy environment where you would typically put in your earplugs, you just go for 5 minutes without them and then step out, right? Stand outside the restaurant, for example, if you're at a restaurant, do some of your grounding coping skills to help support your nervous system. If you start to feel better, go back in for 2 minutes and then cap it and say, okay, I'm going to leave. Then the next time you do it, increasing it 5 minutes with a couple minute break and then go in for 5 minutes more. So 10 in total. And you're kind of giving yourself time to step into an environment that's dysregulating for your nervous system right now, and then stepping out to find your way back into what we call that window of tolerance, right? And then coming back to say, hey, I can still challenge this a little bit. Of course, the kind of timelines I'm sharing with you right now might be too much or too little, and you have to figure out for yourself what might be the best way to run an exposure. However, that is sort of the typical process to support you to, like as Dr. Cam's saying, build that tolerance and wean yourself off of different aids. It's fine to keep them in your pocket, keep them in your purse if you find that you cannot leave an environment where you're feeling really overwhelmed. But when that overwhelm hits, it just means you've been bumped out of your window of tolerance, your nervous system's having a reaction to that. It's important to find a place where you can regulate again. So whether that's a bathroom stall, stepping outside, going in the car for a few minutes, and then the key part of exposure is to go back, even for 30 seconds, for a minute, for 5 minutes. And then if it's still that overstimulation still happens or rises up, then you can excuse yourself for the evening. But in that process, you're going to build up tolerance, and your nervous system is going to learn that even if something's uncomfortable, the stimulus is still, if it's still uncomfortable, it doesn't mean it's unsafe or dangerous. So you're building safety, and that's what we want to see when it comes to certain environments that can be overstimulating.
That's great. Thank you.
Okay, next up is
Okay, good morning again. Can you hear me?
Yeah.
Okay, great. I'm calling from Montreal in Eastern Canada, so it's morning for me, as it is for you guys, I think. My question is around medication and PCS. So I had my concussion 6 months ago, and I joined the program 3 months ago, about the same time as I had to go back to work part-time. I work on a project base, so I couldn't take longer off work. But since then, I've worked on applying all the different principles in the program, the diet, the vagal stimulation, the supplements, meditation, cardio, all these things. I'd seen different therapists with not much help, but a month ago I saw a physio who specialized in concussion care, and she assessed that my persistent symptoms were due to visual and neck dysfunction. So I've been doing more specific exercises and rehab to do with that, which are not helping yet, but I'm hopeful they will. And my main symptoms are sensitivity to light, but also headaches. The headaches are still pretty intense, especially at night. And to deal with that pain, I've been doing all the other things that we talked about in terms of grounding and so on. But I've also been taking Tylenol daily. So I've been taking it for several months now, 2,000 to 3,000 milligrams. My physician's aware of that. I've taken also on bad days or days that are tougher. I also take ibuprofen, 200 to 400 milligrams ibuprofen. So that I'm trying to do that more occasionally than on a daily basis. And more recently, I asked my physician for something else that had helped a friend of mine who'd had concussion in the past. She'd used a product called Cambia, diclofenac potassium powder, and that's helped a bit, but not much. So recently I was speaking to another friend who has chronic migraines, and he said that he got referred to a migraine clinic in Montreal here and was prescribed benzoate rizatriptan. So I know that I heard the caveat at the beginning of the Q&A that it's difficult to give specific advice, and I will be speaking to my physician tomorrow about possibility of introducing other meds, but I wanted to hear from you guys. I'm 55, menopausal woman on hormone therapy. I don't have any hypertension. I don't have any liver problems.
Okay. Maybe I'll take this one first, guys. All right. So, first question, I feel like we've said it a bunch of times. How far are you through the program?
Halfway through.
Okay. Do you feel like you've had a chance to apply some of the things that Melinda's talked about in terms of mindfulness, and how far have you got through my section?
So I finished the mindful the mindset. So Melinda's section, I'd almost completed your section, all the way up to the supplement section.
Okay.
But I've applied the principles in terms of the change of diet for a while now, and I went to took a sneak peek to the supplement list, and so I've already been applying those supplements.
Okay. So have you started some of those supplements?
I have, yeah.
Okay. It sounds like you're using the medications to decrease the pain to make it tolerable so you're able to work. Is that correct?
Will work and other things that can bring me especially the symptoms are intense by the end of the day. So it's in spite of the things that I'm doing, such as the grounding techniques and
Hmm.
different things, like daily life ends up being challenging, like in terms of whether it's socializing or public transport or various things like that.
Right. Out of all the things that you've tried, whether it's pharmaceutical or not, have you noticed anything that makes the headaches better?
Well, I really try to take breaks during the day as much as possible. So days where I can't take breaks are tougher. So breaking every activity up into chunks helps to deal with, I guess, not bumping me out of the window of tolerance. But in spite of that, the pain still gets pretty intense by the end of the day. But I would say it's the grounding techniques probably that are most helpful.
Great. Okay. A couple more questions here just to help us. The concussion specialist physio that you're working with, have they started working on your neck? I'm assuming yes.
Yes, they have, yeah.
Okay, and what has that resulted in? Has it resulted in improvements or worsening of symptoms?
Um, Not much improvement yet.
So,
So
like,
it's
either
yeah.
way, it
Mhm.
hasn't really
Yeah.
improved it or it hasn't made it worse.
Hasn't made it worse. It's pretty much the same still. Yeah.
Okay. So when someone says it's a neck problem, usually you should see one of two things that happen. Dr. Cam knows this, obviously. You should either get worse or it should feel better. It actually, and this is kind of counterintuitive to a lot of people, in my experience, it actually is more advantageous to actually initially get worse because you know you're on the right spot. You know that you are in the area of dysfunction. If a person's been treating you for a month and you're not getting either benefit or worsening, then they're not even in the ballpark of what's happening. Cam, do you agree with that?
Yes.
Yes. So I would clarify with your physio why do they think it's a neck problem and where in the neck is it? Because like we're trying to get to the root cause, right?
Mhm.
Because what I'm hearing here is that you're doing a lot of good things. You're trying to implement a bunch of stuff, but it's not really making a difference to your
Mhm.
symptoms, right?
Yeah, that's true. The piece maybe that is in terms of the visual symptoms, like I find that when I do the exercises, it does worsen my symptoms actually. So with the first, it's been a month since I started, but the first week, it was the symptoms were getting really intense, and so I had a hard time doing them twice a day. But now what I've done is that I'm using the techniques before and after the vagal nerve stimulation to help me do the exercises. And I guess that speaks to what you're talking about, that's probably maybe more the crux of the issue.
Right, exactly. So oftentimes visual dysfunction can be related to something directly with the ocular motor nerves and actually some of the visual systems themselves, but many times it's also related to neck dysfunction. And once you get to Dr. Cam's section, you'll see that there's a lot of connection between the small muscles in the neck, their dysfunction, and also visual dysfunction. So they're very intimately connected often. Um, so I think there needs to be just a little bit of clarification. Do you need, doing the visual rehab or doing some of the exercises, is that progressing? Is that helpful? Are you making any progress? And secondly, the more important question is okay, so you think it's neck. we're not really noticing an improvement or worsening. And that should happen within a couple sessions if they're actually addressing you, whether they're doing it with their active release therapy, whether they're doing it with acupuncture, whatever technique they're using, modality they're using, you should notice a worsening or an improvement. That tells us that we're getting closer to the right spot. And then ultimately, that's going to help you be less reliant on medications and ultimately not have to use them as much. Because if we're really getting no relief whatsoever, then the reason you're getting these headaches, I think, is still yet to be addressed.
With that amount of Tylenol usage, Paul, what do you think about rebound headaches?
I actually don't think that's that high. I think that it's 4,000 milligrams is some of the highest. Maybe if she's getting up to 3,000, you might get a bit of that. And this is kind of where I was driving as that, like, I would rather, the first easy step is trying to implement the right supplements and diet. And oftentimes when you implement a bioavailable curcumin, magnesium in the right doses, omega-3s, those three to start off with can really make the dependence on medications less. And then once you take the medication piece out of it, then I think you're going to have a little bit more clarity on what's actually causing what without that possible rebound headache. Because it is possible, Valerie, for that to happen, where you actually are kind of continuing to take medications and it actually rebounds. Like the medications that your friend is taking, like Cambia and the triptan class of medications. Triptans are for migraines. It sounds like you have headaches that build over the day. That's not migraine related. That's what's called a cervicogenic or tension headache usually. It just means like you're just using your head, you're using your eyes, you're looking at screens. Over time, it's getting worse. That's usually neck related, inflammation related. So we really try to do everything possible to try to lower that inflammation.
Yeah, so I wanted to ask you about like the headache that you experience because you want to make sure that because a lot of times migraine is misdiagnosed. I find in concussion, I think a lot of people get diagnosed with migraines and they don't actually have migraines, which is why, you know, a lot of times being prescribed some of these medications, they have no effect because it's not a migraine headache, so it doesn't really do anything for you. So it's really trying to make sure you have the right diagnosis. Um, and have you watched the headache video that I did? It's on the resources portal. I did a video on headaches talking about the different classifications of headaches, and based on that, you can probably figure out which one you have. Have you looked at that?
No, I haven't yet. I'll take a
So
look at
if you go into the resources and you go to my section and look at past recordings, I did one on headaches, I don't know, maybe a year ago. Eh, I did one like in 2020 as well. I did a two-part series on headaches, but I did one more recently that should give you everything you need. Um, and it'll just talk to you about like how the headache feels and that type of thing. Nikki just put it in the chat. So March 27th. Oh, even it was only a couple months ago. My concept of time is all shot, guys. I don't know what's going on. Um, and so that would be something to look at just to make sure you have kind of the right idea of what's causing your headaches. Because if it's a cervicogenic headache, going on those medications you mentioned will have zero effect. And so you want to make sure you have the right diagnosis. And the problem is if you go to a physician that specializes in migraine, oftentimes the symptoms of cervicogenic seem like migraine, so you get misdiagnosed as migraine. And this happens a ton in concussion, right? They're put on migraine medications and they're wondering why they still have headaches. A lot of times it's neck related. And the fact that when you do visual activity throughout the day, it makes it worse because what happens, or when you do those visual exercises, it makes your symptoms worse. The reason is because every time your eyes move, your neck is engaging. And if your neck is dysfunctional and it is engaging because your eyes are moving, it's engaging in this dysfunctional pattern that then starts to cause referred pain into the head. And so it sounds like it's cervicogenic. What is your physio doing in terms of treatment? Are they giving you like exercises to do? Or are they actually putting their hands on you and digging into the tissues?
both actually. Yeah, so I'm doing
Both.
exercises every day and also doing she did do some treatments as well, some manual treatments.
Some treatments, or is it like every time you see her, she's doing manual treatment?
I've only seen her twice so far.
Oh,
Yeah,
okay.
yeah,
How often are you seeing her?
every 2 weeks.
Okay. So in my mind, that's not frequent enough. But secondly, I don't prescribe exercises to people until I clear out dysfunction. So doing exercises is not helpful for this particular condition. It's manual therapy. When she touches your neck and does tissue work on you, does it cause your headache while she's doing it?
Yeah, it does. And when I do the exercises as well, and the neck exercises, it does increase the symptoms too.
Okay.
What? Yeah, but that might just be because there's dysfunction there.
Mhm.
So in my opinion, I mean, again, I'm not your practitioner, and I would just maybe talk to your physio or, um, see, I mean, you might need a different practitioner too if they're not getting to the root of it. But if they're causing your headache while they're treating you, it sounds like they're in the right spot, so that's good. In my opinion, it's like you go straight after manual therapy, and once you get rid of the headaches, now you start to do exercises to kind of stabilize and strengthen so that they don't come back. But doing exercises when there's dysfunction, all it's doing is just accentuating that dysfunction. You know what I mean? Like I always say, if I have a shoulder injury, it's going to change how I move my shoulder. So if somebody gives me shoulder exercises for my shoulder, I'm going to do them in an abnormal way because I want to get around that painful spot. So I'm going to move my shoulder in an abnormal way, not consciously. It's just what my body does because it tries to avoid it. And in doing that, I'm actually reinforcing a faulty movement pattern, which means I'm creating more dysfunction in that area. So the way I look at it is let's clear the dysfunction. Let's get things moving properly, situated properly so that we're not having that pain anymore. Once we don't have any pain, now I can strengthen that shoulder in a good way so that I have proper movement patterns and I'm actually reinforcing good movement. And that's the same thing with the neck. A lot of times on the physio side, they tend to be more comfortable with rehabilitation-based exercises. So they'll often prescribe that. Whereas on the chiro side, we're more comfortable with manual therapy. So that's where we typically go. But usually what I do is in my clinic is that I will treat the neck, get rid of the pain, get rid of the headaches, get rid of the dysfunction, and then I will immediately send them to the physio to do their part, and they will do proprioceptive and strengthening stability type rehabilitation to prevent it from coming back in the future. It's just a different way of looking at it. But I would say you need more sessions. I typically start with once a week, and sometimes you need twice a week, depending on how long of a relief period you get. Um, but are they treating the front of your neck too, or the back of your neck?
Mostly the back. I forgot to mention that I had had a car accident in 2014, and at that point I had a lot of problems with my neck and a
Right.
herniated disc C5, C6 level.
Yeah. So you definitely have neck dysfunction, and my money right now would be on that you don't have migraines. If I was a betting man, then I would be putting my money on the fact that this is neck dysfunction because you've had previous neck dysfunction and neck injuries. So another one for you to watch is the manual therapy videos. So I did a two-part series on manual therapy. It'll kind of show you exactly what you're looking for in terms of manual treatment from a practitioner. So if you go and watch those two plus the headaches, you'll have a really good idea of what you're looking for and whether or not you're getting what you need at this particular place.
Okay.
Does that make sense?
Yeah, it makes sense. And if ever there's any recommendations, because I've tried to see many different people, but if you know of any people in the Montreal area that you recommend, I'd appreciate it.
I have a few. I have a few. Why don't you watch those videos and then reach out to me on the platform? Just send me a direct message on the platform.
Okay.
And if you're like, oh, I'm not getting what I need from this particular person, I might send you, I have a couple ideas in mind for in Montreal.
Okay.
Okay.
I also
Perfect.
think you haven't really seen that person enough. So two
Yeah, it's
sessions.
only been 2 sessions, but I still think it should be more frequent. Like, I think you really need to get on like a weekly thing, just getting the manual work to see,
Yeah.
is this doing anything? Because a lot of times people will focus on the back of the neck and they won't do anything on the front. But like the back of the neck in isolation won't help. It's like you need kind of that more global approach. But if you watch those two videos, you'll see what I mean and why that is. And I think that'll just give you a really good idea, you know. And you could even bring that to that practitioner and be like, hey, what do you think
Mhm.
about this? And then maybe if they're willing to do it, then great, you don't have to change providers. But if you're like, they're still not really getting what I think I need, then you can look at changing and you can message me and I'll give you some suggestions.
Then to bring it full circles, like you can use the medications to kind of like get through the day. But ideally, I think what we talk about in the course is we want to get after the root cause, which is what we spent the balance of the question talking about. and then see if you can implement some of the diet and supplements to maybe reduce the reliance on medications, which can confuse the picture a little bit. You actually, one of the biggest liberating pieces of information is that people need to realize is that they need to get that manual therapy more frequently. So once or twice a week in the short term initial phase, and then they can go to once every 2 weeks or once a month. That's more of a maintenance. Number two is that you want to actually find discomfort. That's, I know, anti what every inclination we have in our bodies, but you want to have a little bit of discomfort. And that means that within 24 hours, it should resolve, but you are looking for that's the painful point. And that means that you're on the areas of dysfunction. And then you could be really working towards resolution. And within short order, you should notice that it's better. It's getting better. But I think you have a good couple of things to start here with.
Okay, thank you.
You're welcome. All right.
Hi, thank you. One, I love your program. I have implemented everything and I'm working on the exercise and neck dysfunction at this point, kind of simultaneously. Can't quite figure out how to organize those two things. I did do your test and I do have orthostatic hypotension on average. When I go from laying to standing, my systolic drops 30 points and my diastolic drops about 15.
Okay.
I have to tell you, last summer, I was documenting, I'm having symptoms. My blood pressure was this. I was doing all these tests. I brought it to my doctors and they're like, well, blood pressure changes. Like, you can't do this. And they continue to tell me that my blood pressure is great when it's like when I'm sitting in a nice, cool office or whatever. So, like, out of my mind, I had like tears and frustration when I was just like, it was so simple. Why couldn't they do this for me? But anyways, so I'm working with that and I'm trying to get myself on that protocol for POTS. I bought myself a little bike thing to put underneath my chair to just kind of start kind of doing it, but I get really nauseous every time I do that. And I have been walking, and walking on different days is different. So sometimes walking's kind of fine and I'm capable, and other times I'm crashing, I'm fatigued after, I get headaches, I have all sorts of increased light sensitivities. So, and I usually walk outside. So there's an element with my walking habits that are like, I get somewhere and I don't have an easy, oh, I've got symptoms, time to stop. It's like, oh, I've got symptoms and now I've got to get back to the part. So I'm interested in how to work those, but also what is going on in my neck. I often feel a lot of strain in my neck when I do any sort of movement. Prior to this, I was a kickboxing instructor, yoga teacher, health and life coach. Like, I was very, very active and I can't do any of that. And the only thing I've done is like slow walk over the past year. I try things and my symptoms will go on for 2 weeks. Like, I will get 2 weeks of very distinct eye aura migraines, like when I kind of flare myself up. And I have an appointment for Friday to start some active release techniques with a chiropractor. I have been seeing a chiropractor I would say 1 to 3 times a week consistently since December. Different chiropractor, clearly not doing the right things. But in terms of kind of building exercise, is it important to get my neck stable? Because I think that that's definitely my injury this time came from, I wasn't even surfing, I was just playing in a wave, but the wave took my face down to the bottom of the ocean and then snapped my body into a scorpion pose over my face. So the neck took the brunt of it. So how do I balance kind of moving forward on this exercise thing, and how much is the neck tension and instability that I'm feeling part of the symptoms that I'm engaging? So the balance between getting back to exercise and getting the neck stabilized first? That is my big question.
Yeah, I mean it's a puzzle, right? So I'm listening to this story and my mind is going in like a million different directions as you tell it. So autonomic dysregulation, right? So it sounds like you have some dysautonomia because of the orthostatic issues that you're experiencing. Um, so the basic things are obviously increasing fluid intake. I'm assuming you're doing that with
Yes.
electrolytes.
Yes.
Okay. And then some of the other vagus nerve stimulation type techniques, like the humming, the breathing techniques, those types of things, you're doing those.
Mm-hmm.
Okay. There's also obviously like, to help your autonomic nervous system getting good quality sleep, eating a healthy diet, those types of things, reducing stress and anxiety. Yes?
Yes, yes.
Okay. So then when it comes to how the neck relates to this is that a lot of your kind of autonomic system is actually associated with neck dysfunction as well. And the interesting thing about like POTS, right? So not so much orthostatic hypotension, but I'm going to classify them in the same kind of vein.
Mm-hmm.
When you look at people that develop POTS as a result of concussion injuries, then it's more so, it's not like traditional orthostatic intolerance issues. Like traditional orthostatic intolerance issues you typically see in, post-pubescent females way more than males. Particularly those with like connective tissue disorders. Do you have any connective tissue issues that you know of, like Ehlers-Danlos or anything like that?
No.
No. Okay. That's the typical kind of criteria for people that develop these issues. But after concussion, we see a different picture. We see that it's basically the same males to females. It's not necessarily related to connective tissue issues, and it seems to be mostly related to other somatic symptoms that people are experiencing. So it tends to be highly related to other concussion symptoms. So you can kind of look at it in two ways. One, we can go after like the orthostatic issues and kind of treat it like an isolated, orthostatic hypotension, which means then maybe there's potential medications they would want to put you on. You'd want to be doing the fluids, you'd want to be doing the, compression stockings just to help with getting that blood pressure back to your body when you do stand up. That type of thing. So that's like kind of the traditional approach to it. The other idea is that we almost shelf the autonomic issues and try to treat the other symptoms in hopes that the autonomic issues kind of go away,
Repair themselves.
right?
Okay. Mm-hmm.
So and I don't know what the right answer is, right? I
Yeah.
think probably a combination of the two is probably the best bet. And so because of neck dysfunction resulting in autonomic dysregulation, I think that you would want to do both of them kind of simultaneously as you're already doing.
Okay.
When it comes to the exercise, the fact that when you're doing that kind of seated recumbent biking exercise, you always feel nauseous, you may just want to tone down the intensity a little bit. Try to
Okay.
find what heart rate you're at. So if you're monitoring your heart rate, try to like every, start very gradually so that it's your heart rate, goes up by a couple beats, you're monitoring it. Then when that becomes, stay there for a minute or so. How do I feel? I feel okay. Now I'm going to go up a little bit more. So you're almost giving yourself a bit of a treadmill test or a bike test in a recumbent position. Because what you want to find out is, okay, what's this point that nauseousness gets out of hand? And then I'm going to look at my heart rate and say, okay, it's a heart rate of 135 is when that really starts to kick in. So now when you go to do the exercise, you're going to want to stay about 80% of that heart rate. So take 135 times it by 80%, 0.8, and that'll put you at what your exercise level should be. And then when you're exercising now, you're going to stay at that kind of low heart rate so that you're not triggering that sensation, so that you're getting the exercise in without going over your threshold. And then you're going to do that for a week or two even. And then you're going to retest your threshold. So you start pedaling lightly. Okay, my heart rate, once your heart rate climbs a bit, let it stabilize at that particular rate. And then you're like, okay, I'm going to push a little bit harder, go a little bit harder, stay at that rate, let the heart rate stabilize a bit. How do I feel? I feel fine. Okay, now I'm going to go to the next level. As you do that, you'll probably get a higher threshold before that nauseousness starts. Then you take 80% of that and you stay there for another 2 weeks so that you're always exercising kind of below your threshold. But every 2 weeks or so, you're going to challenge that a bit So that the intensity can increase over time without causing that. When you're going for walks, I would just walk around your block. So it's gonna be boring because you're gonna see the same stuff over and over again. But at least if something happens, the walk home isn't so long that you're like, I'm at the end of my walk now, and now I got to go all the way back, and I'm already feeling like shit. So I would say just stay local, very hyper local for a bit, so that if something does flare up, you're 2 minutes from home and not 30 minutes from home. So that would be my advice there. And then in terms of ectromy, I think adding in the ART piece, I would also, if I were you, go watch that 2-part series on manual therapy just to make sure you're getting what you actually need. This other chiro treatment you've been getting, has he just been doing adjustments?
I have seen 3 chiropractors,
Okay.
all different things. The first chiropractor I saw right after, I got so sick. I was like, I cannot do that again. And a lot of it, like even massage, was just like, I cannot do that. So I've built myself up to the point that I even have tolerance to be touched. So I started with network chiropractic
Yeah.
and progressed. So now I have been doing like manual manipulations, snap, crackle, pop type things, some stim, 10 stimulator before an adjustment kind of stuff. But the snap, crackle, pop has been what I've been doing, but they haven't been getting into the soft tissues for
Right.
sure in the neck.
So now one thing to be aware of, if you do have autonomic dysregulation and your body is in that kind of hypervigilant state, sometimes having people dig in on those tissues can flare things up a lot. So you want to make sure you have really good strategies for calming your nervous system so that in the moment you can kind of call upon those. And I would just let them know that sometimes I do flare when I go through manual work. So just have them start very light just to see how you respond. Right. So if somebody already has this kind of thing, I'll be like, okay, I'm going to take it easy on this particular patient, but you might want to let them know that. I do that instinctively because of my experience in the concussion space, but a lot of practitioners may not have that. So just being able to say, look, sometimes I get really flared up if things are, with manual work. So just, go a little bit easy on me to start and see how I respond, and then we can kind of go from there.
Awesome. One other question, because I didn't see it in your thing. I have been experiencing numbness and tingling in my face, in my hands, in my legs, kind of since the first month after the concussion. Is that anything that raises a flag? Anything I should look
Yes.
into for that?
Yes. Have you had any type of MRI on your neck?
I've definitely had imaging on my neck. I think I've had MRI on my neck, but I
I
went
would
originally to the ER when it first happened, and I think they did an MRI on my neck and head, and they were both.
They would probably do a CT scan in the ER
Oh, okay.
because they'd be
Yeah.
looking for a fracture, and that's usually like if they're looking for bony stuff or a bleed, they'll do a CT. So usually in the ER, they're going to do a CT.
Okay. So get
I
an MRI.
I would ask for an MRI because sometimes things can evolve over time, and especially if you're experiencing these types of neurological symptoms, getting your neck manipulated is not a good idea
Okay.
until you've made sure that everything is okay with the spinal cord and the spinal canal. And also I would make very sure that you don't have any connective tissue issues like an Ehlers-Danlos or something like that. Like, are you really flexible?
I am, yeah.
Yeah, so sometimes these things go under the radar. People just assume they're really flexible, but they actually have a connective tissue issue, which is actually a contraindication to adjustments. If somebody has
Okay.
Ehlers-Danlos, we should not be adjusting their neck at all.
Okay.
And especially if you're experiencing numbness in your limbs, you want to be you want to make sure you check that before you get any type of
Yeah.
manipulation or neck work, right? So that would be my first step for you is to go to your family doc and be like, I'm experiencing numbness in my arms and legs, and I think I need some imaging on my neck. Can you order me an MRI? I think it's very important to rule that out, and also just say somebody mentioned possibility of like, connective tissue issues. And I'd like to have some testing run for that just to make sure that I don't fall into that category. Because a lot
Okay.
of times, especially with, females that are, into yoga and stuff, they just assume that they're really flexible, but there could be some connective tissue issues there. Um, which a lot
I
of
have
people
been
do that.
tested for
You
Ehlers-Danlos
have.
before and it came back negative.
Okay, good.
Not
Okay,
related
good.
to this, but
Okay, good. So that's good. But the MRI I think is important based on the symptoms that you're experiencing, just to make sure that there's nothing else going on. And if there is, you definitely want to not be doing, high velocity
Yeah.
neck adjustments.
What did that first chiro do to flare you up so bad? Just out of
he
interest.
didn't even touch my neck. And when it first happened, it was just like nobody would touch my neck. And I was like moving around from my waist, like my neck had no movement in it whatsoever. So he had just worked my lower back muscles to kind of create some whatever. And I still was like so reactive to everything. It's been like a long journey. I've definitely seen a lot of improvement, but I'm definitely also at a plateau that I'm stuck. And I get better from October to April. And then May, it starts to get warm again. And I just crash and burn with all of the orthostatic hypotension stuff kind of increasing through the summer. So I'm getting to the end of that. But
Sounds like the heat dilates
the,
your.
the heat's a bitch for me right now.
Yeah.
Yeah, I mean, you do have definitely some autonomic dysfunction markers. It sounds like you may not have full-on POTS, but you definitely have some dysfunction. Remember, orthostatic hypotension is not POTS, but it is part of the autonomic family. That doesn't mean that you wouldn't benefit from implementing a lot of those things. I think some
Yeah.
of the core things in the Concussion Fix program are absolutely helpful for anybody that's dealing with the spectrum of dysfunction in the autonomic world. Definitely some of the simplest things like optimizing your hydration with salt. Like if you can't do salt, electrolytes. Like I have an electrolyte almost every morning. And so I'd suggest that you do that a couple times a day.
Okay, this might be beyond like what I can ask, but I have an old kidney thing. So regular electrolytes are usually not recommended for throwing off potassium levels in my system.
What's an old kidney thing?
I had an autoimmune disorder that affected my kidneys, so my kidneys are at lower function than they should be, and that's kind of just what I'm living with. But the autoimmune disorder is considered in remission.
I mean, if you eat an avocado or banana, do you avoid those?
No.
Yeah, then you're gonna get way more potassium in there, or coconut water. Then I don't think the 50 milligrams of potassium or 100 milligrams of potassium is gonna be a problem.
Okay,
You're gonna
thank
get
you.
way more of that. I think you'll be fine. Anyways, I think we've covered and given you some good places to start. Definitely stop the high amplitude, high velocity, low amplitude like neck treatment, and just go back to manual if you can. Do some of that soft tissue, see if they can still work on you. They just can't crack your neck. Just in case you have some sort of instability there, the last thing we want is for you to get hurt. And then keep progressing through the program. We haven't even talked about all the Melinda stuff, which is still going to be so powerful. Like I still believe ultimately, like for autonomic dysfunction, doing the first part of the Concussion Fix program is the deepest root cause stuff. So I know we haven't heard from Melinda here in a while, but that section is so important.
Yeah, I think you had some specific questions today about, more of the functional and physical aspects, and that's great. But as Dr. Paul's saying, there are elements of autonomic nervous system that can be really supported by some of the foundations we have in the course. So for now, just kind of move through those. Make sure you're implementing some of the, if you've already been through mindset, great. And making sure to implement the nervous system regulation piece, because that will be a huge help for the autonomic issues as well.
Okay, I really appreciate it. I really thank you all from the bottom of my heart for the program you've put together here and the breadth that you kind of meet everybody where they're at. It is 2 thumbs up. I would give more if I had more. Thank you.
Appreciate it.
All right. We do have a few questions in the chat. We can kind of just go through quickly as we wrap up. This one will be for Dr. Hrkal. I have an elixir blend with lion's mane extract, lotus pollen, cardamom, green tea pollen, but it has a best before date of a couple years ago. I'm a firm believer of best before not expired and eat a lot of food past the date or take supplements past date, but no, they just may not be as potent. Would this still be okay to consume? It's all dry, smells okay, looks okay through the bag.
Yeah, I would think so. Dried herbs, as long as they've been dry and sealed, are really just going to lose some of the active ingredient potency. But at worst, you have just a nice herbal elixir that it maybe is not as therapeutic, but I think you're totally fine.
I have issues with fatigue, and while I know what I can do in general about it, it challenges me a lot in the moments I suffer from extreme exhaustion. This often happens after I cross my energy borders. They're working on that. And in those moments, they fall in bad behaviors like trying to get energy through food, scrolling through the phone, etc., even though they know it doesn't help, but they don't know what else to do instead. They feel like nothing is helping, and what can they do in those critical moments when all their energy is gone, they're unable to go from walks or anything like that?
I mean, there's a lot of things that can cause energy issues in concussion. I particularly done have a presentation on fatigue just to kind of like work through some of the reasons that may be underlying. Post-concussion fatigue can be a symptom, but it also may exacerbate underlying iron deficiency. It may have to do with hormonal issues that have the fatigue. So what is causing some of that stuff? That would be the first step. And then what do you do when your energy's all gone? Uh, you know,
Might be my area, I think.
yeah, maybe Melinda, I don't know if you want to add to that.
Yeah, I was kind of thinking of the lens of, motivation, mood. You know, this person hasn't described sort of where their mood is at, because a lot of times exhaustion comes with depression. It also comes with extreme anxiety, right? Once we've been in a state of high anxiety, which is usually heightened energy, we can often run out of energy. You also mentioned bad behaviors like getting energy through food and scrolling. So those are sort of our escape avoidance behaviors when we're feeling anxious, overwhelmed, depressed. So I am maybe thinking there could be a mood component to this that might be really helpful to explore as well, alongside what Dr. Hrkal is suggesting. Um, there are, of course, so many reasons that low energy and exhaustion can happen with PCS. So, I think, I can hear Dr. Cam in the background saying start from the beginning of the course and move your way through. I'm not sure where you are in the program right now, but that could be something to check in with if you haven't started yet. I think you'll learn a lot about this as you just begin, start listening, start moving through it, and you're going to learn a lot of strategies and supports for working through exhaustion and fatigue.
Can I maybe add something to that? So that was my question. Can I maybe say something to it?
Yeah,
Sure.
So actually, I do not have that much issues in such moments with my mood. Sometimes I do, sure, but not always. Like yesterday, I had a day like this. I had no energy at all. And in this actual moment, I really didn't know what to do. Should I just lie around, try to sleep? Should I meditate? Try to go for a walk, even if I feel like I cannot do it? What's the best to do in such moments?
Yeah, I get the sense that you just don't know how to help yourself.
Yeah.
Has anything helped in the past? You did
No, not in that really critical moments when there is really no energy at all left. So when I have low energy, of course, there are things that are helping, like going for a walk or something like that. But when it's really like yesterday, where there was no energy at all left, I really don't know what to do.
Yeah, I mean, it could start with some basic things like Dr. Paul had said earlier around like drinking water, making sure to try some electrolytes, seeing whether it's sort of a nutritional thing, which I'll let him speak to in a moment in a bit more detail. But the other things I'm thinking of is, being outside your window of tolerance. It happens alongside physical energy lows as well. So you can think about, if I just can't get up right now and I can't go for that walk and I don't have anything left in the tank, well, you don't want to necessarily force yourself to do that, but you could do things like some of the somatics from a sitting position. So pressing your hands together, pressing your feet against the ground, bringing some groundedness, but also bringing energy into the body when we're on that low end of the window of tolerance. And if it feels like there's a mood component, right? Like I just have no motivation, I just, just don't want to do these things. It could be more around something we call behavioral activation, where you could grab a ice cube and just like try to bring yourself out of this state of, not being able to physically move. And it sounds like it might take a little bit of experimenting to see what that reason is. Is it just pure physical exhaustion, something that needs to be examined by another healthcare provider? Or are there small things that you can do from a, movement, somatics, mental health, self-care front that can create some movement for you? So there's no harm in sort of trying some of the things I suggested to see if it does make a change, because then you know that the nervous system might be part of what you're experiencing. Because if it is, you'll notice some changes in how you feel following doing some, if it's a grounding exercise, a somatic exercise, to bring yourself back in that window of tolerance. If that doesn't work, it could just be something more physical, and maybe I'll turn it over to either Dr. Paul or Dr. Cam now.
Thank you very much. That's already really helpful. But I have one question. I didn't understand what you were saying. You said something like electrical light or something like this?
Electrolytes.
Okay.
Yeah.
Okay, thank you.
I'm sure Dr. Paul can explain how those help you.
Yeah, I mean, like little simple things like hydrating, but particularly with electrolytes, they seem to be very helpful with energy in my experience. They're going to help support blood flow, and they're going to support your production of cortisol from your adrenal system. They're like what the the seminar that Nikki posted in the chat and the Q&A, I think is so helpful just to kind of help you check off some of those things that are underlying. And sometimes it's just fatigue from overexertion, and that happens. Really do everything, even if it's like I'm so exhausted. Once you kind of lie down and totally rest, it usually makes you even more tired. So if you can go for a very short walk or do something that you can move a little bit, I think that kind of helps you just get through the day. Go and have a nice glass of electrolytes. You can get a powder that's already pre-made, and that kind of gives you a little bit of an energy without some of the downside. Some people find something like matcha tea, which has a little bit of caffeine, but also a ton of antioxidants, with L-theanine, which is a calming amino acid, very helpful for mood and energy, particularly, I should say, more so than mood. That is another little hack that you can do in the interim until you figure out what's actually happening and what's driving that energy dysfunction. The last thing I'll say is the most underlying sneaky reason why energy is low for people that have PCS is usually HPA axis dysfunction or adrenal dysfunction. And this is the hormonal system that helps all the other hormonal systems do their job. It helps your blood flow, so it has a very important role to play with the autonomic nervous system. And it helps us deal with stress ultimately. And the production of cortisol and then those catecholamines can be really, really integral in trying to regulate that energy level. So working with a healthcare provider that understands the adrenal system, usually it's a naturopath, usually it's some sort of medical doctor that understands what to do with testing and how to address it. But ultimately, going through the program, implementing all the things that Melinda talked about is one of the key steps to doing that.
Okay, thank you very much. That was very helpful. Thank you.
You're welcome. Keep us posted. We'd like to see how it progresses. And hopefully, as you go through the program and implement over time some of the effects, you're going to get less and less of those exhausted days. But just understand that that does happen. And as your body adapts and as you have neuroplasticity and vascular plasticity that happen, you should feel less and less of those days.
Mm-hmm. Nikki also posted some of our lives or presentations that we've done on those topics in the chat if you haven't seen it yet. So you can look those up under the resource section.
I was just going to say that. Thanks, Melinda. One last question, more for you, Melinda. When at rest, and we've had a few members mention this in the chat, when they're resting, their nervous system feels jittery. Any recommendations on what they can do?
Yeah, I think that's a really common physical symptom that shows up when our nervous system is, dysregulated in some way or out of balance. And it's kind of, we can almost frame it more positively in the sense of your nervous system sending you a message and you're able to hear it, right? It's saying, hey, I feel jittery when I'm sitting here, when I'm trying to relax. It's just your nervous system's way of sharing with you that something's out of balance. So, we've got this all laid out in the course under the regulating the nervous system section. I would just recommend starting from the beginning of that section and moving through. If you've already been through recovery mindset, fine. So you wouldn't have to go back to that one. But if you start with the regulating your nervous system, it'll walk you through all the ways to sort of support you. So for example, we present a certain distress scale in the program so you can decide, which practice might be most helpful for me based on how I'm feeling. So if that jittery feeling makes you feel like 9 out of 10 on the distress scale, then we recommend practices like grounding and stabilization or micro practices and mindfulness to help support you in that moment versus let's try meditating, for example, because meditation is something that we actually need to feel a little bit more balanced in our nervous system in order to do effectively. So all of that is laid out in the regulating the nervous system module within the 2.0 program. So I would just direct those individuals to that section and go from there. And if you are not close to that section yet, and with our advice, we always suggest not to skip ahead, then it could be really implementing basic grounding skills right now and seeing if there's any improvement in that jittery feeling. So for example, can I find my feet against the ground? Can I take 3 deep breaths? Maybe I find a place to walk back and forth for 12 steps just to find some groundedness in my body. There's also the lives we did on somatics, which can be really helpful when there's a lot of imbalance in our nervous system that you can listen to if you're not close to that nervous system module in the course yet. So Nikki will pop those in the chat momentarily. And those are great sort of gentle movements that can stabilize the nervous system and help balance things when you're feeling really overwhelmed. Okay.
Awesome. I'm just pulling up the somatic one because it was done. If you go to Melinda's section, Somatic Therapies Part 1 was done on November 9th, 2023. And then Part 2 is February 8th, 2024. So those would be good seminars to check out on those. And I think that is a great spot to wrap up this week's Q&A. So thank you everyone for coming on. We always appreciate it. We love being able to support you along your recovery journey and answer your questions.
Bye-bye.
See you, everybody.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.